and we are representing our college, Himalayan Pharmacy Institute.
And so today we have set up this health
Medical camp. It's a free camp where
We are checking the blood sugar
blood sugar
level
levels and high blood pressures
of the local people of Majitar, and we have organized this. Our college has taken
The
small
great
steps
initiative.
towards the health of the people in and around Majitar, and so you can see
there are so many people. We have went to small villages which are situated in the Majitar. We have traveled a lot. We have gone door to door and knocked the doors, and we have aware the people about how important our health is, especially when people are doing the self-medication. They don't know about the doses and all, so they might sometimes take the overdose. So now we can put our professors and we can say.
On the eve of World Health Day, Himalayan Pharmacy Institute is organizing blood pressure awareness program as well as diabetic awareness program in this region. And in this region is concerned, there was no epidemic data was available about the people of Sikkim. And the Himalayan Pharmacy Institute is planning to document this how much epidemic level of cardiovascular disorders and diabetic in this region because of more modernization of this area. Because in 10 years back, this was no pharma industries, no hospital facilities available. But nowadays, the Sikkim is getting a 1,000-bedded multi-speciality hospital. The people are getting good health coverage in this region. And now we have to make proper documentation of epidemic data of this region. So on the eve of World Health Day, the Himalayan Pharmacy Institute is trying to achieve some data entry of epidemic data entry of this region people. Thanks.
thank you, sir. Now we'll move on
No,
to
something, sir.
Speak, share your speak.
anything, sir, about the camp.
So today our camp is going on very nicely in the occasion of World Health Day. So we have our Himalayan Pharmacy Institute have arranged different kind of activities like rallies, blood donation camp, etc. So hope that it is successful.
Thank you, sir. Now,
Now here we are moving on to the table.
Where the BP is getting checked and here the glucose levels are getting checked. So you can see these are the advanced machines which we are using.
We are collecting data here.
Data's here in this laptop. It's connected with the laptop and it's showing the result of the BP.
We are organizing World Health Day. Today we are organizing World Health Day in the college, and so we have organized some camps. We went to Khanikhola Gao, then there we treated some of the patients, and here also we had a camp here. So we treated almost 90 patients over here. So they're feeling good. I think this type of program should be every 3 months. Means in 3 months once to it should be, na? So that we can show our professional course. Okay, thank you.
Thank you so much. आप लोगों ने ये वीडियो देखा और आई होप कि आप लोग भी अवेयर हो गए होंगे. अगर आपके भी घर के आसपास कहीं भी अगर ऐसा हेल्थ कैंप सब रखे गए होंगे किसी भी कॉलेज स्टूडेंट से या कोई भी मेडिकल हेल्थ से आए होंगे, तो प्लीज़ आप भी जाकर अपना बीपी और ब्लड शुगर लेवल प्लीज़ चेक करवा लीजिए. सो आप लोग भी अवेयर हो जाएंगे कि आपका हेल्थ कैसा है, कि हम लोगों को सेल्फ केयर रखना